Thank you for having me. Uh, Again, my name is Mark Derbyshire. I'm the owner of Park Moving and Storage in Aberdeen, Maryland. My parents started the business in 1956 as a small company, and Aberdeen is outside of Baltimore. It's a small town. And in the area, there are many small businesses that we have to compete for employees from my industry and from other industries. I currently have about 30 full-time employees, and I invest a lot of time into them because I want to attract people who are interested in staying with the company for a long time. One of the benefits I'm most proud of is, of course, providing health insurance. Times are tough. Good workers are looking for the best opportunities. It is important to me to limit turnover so I can try to make sure that the people I invest my time and energy are committed to the company. I do not want to train people that might leave as soon as something better comes along. I have learned that higher compensation, the higher the motivation, and that is one of the reasons I provide health insurance. Also, I know my workers want to give 100% to their jobs, but if they have health problems that are left untreated, they can't. That hurts them, and it hurts my bottom line. It is not easy to provide health insurance to all the employees. Every year the premiums go up. And every year I've got to go back to the employees and ask them for a little bit more. Right now, I am paying 85% of their premiums for individual rates and 75% for the family rates. I can't continue to pay more. Year after year, the premiums are going at double digits. Often, we small business owners are attacked for not providing health insurance. What people fail to realize is that high cost of administration coverage for each employee, in addition to the rising cost of premiums. For a small business, the increased costs for fuel and raw material, along with the decreased revenue, can be a lethal combination. Many of my fellow business owners have been struggling with the idea of ending employees' health insurance to reduce overhead. All around me, companies fold under the pressure of rising health costs, and they stop offering the benefit altogether. That choice, I hope, will not be one I have to make. I worry about what would happen to our employees if they do not have health insurance, and I cannot afford to have productivity decline because people are sick. Businesses like mine that do not provide health insurance end up bearing the brunt of the cost for the uninsured workers of other companies. That hardly seems fair, especially for small businesses like mine, that tight profit margin. It is difficult to provide insurance for my own workers. I cannot afford to have premiums go up every year to help pay for the care of uninsured workers of other businesses or my competitors. When those uninsured workers end up in the emergency room, the cost of that care shows up in the hospital bills for my workers. My insurance companies, in turn, passes these higher costs to me in higher premiums. Those of us who do the right thing by providing health insurance now have to bear the unfair burden placed on my businesses that do not do their fair share in paying for health care costs. It is a vicious cycle. When premiums go up, businesses drop coverage, resulting in more uninsured workers. Those of us who continue to do the right thing by providing insurance get left holding the bag. Every year that bag gets heavier. This year, I do not know if I'm able to continue paying for coverage for families. I try not to think about what would happen if I get rid of this benefit, what would happen to my employees, their kids. Worry that some people will look for other jobs and that they might have a tough time finding the same caliber of hardworking, high-quality employees. If all businesses were required to offer health insurance, the burden would be lightened for all of that are providing health insurance and all businesses. Businesses like mine need the federal government to help us level the playing field. All businesses should pay their fair cost of health coverage so that none of us have to take the extra burden. Thank you.